Every single day, millions of people around the world drink 8 glasses of water because someone told them they should. They carry water bottles everywhere. They track their intake on apps. They set reminders on their phones. And despite all of that, despite drinking what they believe is enough water, they still wake up with dry mouths. They still get headaches by mid-afternoon. Their skin still looks dull. Their joints still ache. And their energy still crashes. I'm going to tell you why that's happening. The problem is not that you are not drinking enough water. The problem is that your body is not absorbing it. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle, giving you the medical information that actually works, information the system will not give you, because there is no profit in teaching you how to hydrate correctly using ingredients that cost less than $2. Here's what nobody tells you. Water absorption does not happen in your stomach. Your stomach is just a holding tank. The real absorption happens in your intestines, and whether that water actually enters your bloodstream and reaches your cells depends on something called osmotic gradient. That is the scientific term. In plain language, it means your intestines will only pull water into your body if that water contains the right balance of minerals and electrolytes. If you drink plain water, especially in large amounts, it moves through your digestive system too quickly. It dilutes your electrolyte concentration, and your body, trying to maintain balance, actually pushes that water back out through your kidneys. You urinate it away within 30 to 45 minutes. You are hydrating yourself in theory, but dehydrating yourself in practice. 15 years of clinical practice taught me what people need to hear and almost never get told. I have watched patients come in complaining of chronic fatigue, brain fog, muscle cramps, dizziness, and constipation. Their blood work shows nothing alarming. Their doctors tell them everything is fine. They leave confused, frustrated, and still feeling terrible. When I ask about their water intake, they always say the same thing. Doctor, I drink plenty of water. I drink more than 8 glasses a day. And when I ask what they are drinking, it is always the same answer. Plain filtered water, all day long, in large amounts. The healthcare industry is not built to teach you how your cells actually work. It is built to sell you bottled electrolyte drinks with 30 grams of sugar, expensive mineral supplements, and IV hydration clinics charging $150 per session. There is no revenue in telling you that proper hydration requires half a teaspoon of sea salt and a squeeze of lemon. Your next doctor's appointment will not include a discussion of cellular osmosis or sodium-potassium pump function. There is no billing code for that. Let me explain exactly what is happening inside your body. Every single cell in your body is surrounded by a membrane, a thin barrier that controls what goes in and what stays out. That membrane has millions of tiny protein channels embedded in it. These channels are gates. They open and close based on electrical signals created by mineral ions, specifically sodium, potassium, magnesium, and chloride. When you drink plain water without these minerals, the water sits outside your cells. It cannot enter because the gates stay closed. There is no electrical signal telling them to open. Think of it like trying to open an automatic door when the sensor is broken. You can stand in front of it all day, but without the signal, the door will not move. That is what happens when you drink mineralized water. Your cells stay locked. The water you drank passes through your intestines, into your bladder, and out of your body without ever reaching the tissues that need it. Meanwhile, your brain, your muscles, your organs, they are all screaming for hydration, and you keep drinking more plain water, making the problem worse. Here is the mechanism. Your kidneys regulate fluid balance by monitoring blood sodium concentration. When you flood your system with plain water, your blood sodium level drops. This is called dilutional hyponatremia. Your kidneys detect the drop and immediately activate a hormone called antidiuretic hormone suppression. That is the medical term. In plain language, your kidneys stop trying to hold on to water. They dump it as fast as possible to restore sodium balance. You feel the result as constant urination, sometimes every 30 to 45 minutes, especially if you are drinking large amounts throughout the day. Now, the most important thing I want you to hear. This is not just about feeling thirsty or having dry skin. Chronic cellular dehydration, the kind that happens when you drink plenty of water but absorb none of it, causes systemic inflammation. Your blood becomes slightly thicker. Your heart has to work harder to pump it. Your kidneys strain to filter waste without adequate fluid flow. Your joints lose lubrication. Your digestive system slows down because the intestinal walls need water to produce mucus that moves waste through. Your brain, which is 75% water, starts to shrink slightly inside your skull, pulling on the membranes that anchor it. That pulling sensation is what you experience as a dehydration headache. Let me tell you about a patient I saw 3 years ago. Her name was Margaret, 58 years old, a retired school teacher. She came to my office convinced she had chronic fatigue syndrome. She had been to 4 different doctors. They ran thyroid tests, checked her iron levels, screened for autoimmune conditions. Everything came back normal. She was drinking, she told me, 12 glasses of water a day because she read online that more water would give her more energy. Instead, she felt worse. She was exhausted by noon. She had constant headaches. Her skin looked gray. She was urinating every 45 minutes. I asked her one question. "What are you drinking?" She said, "Water, just water. Filtered water from my refrigerator." I told her to stop drinking plain water immediately. I gave her a specific protocol. Every morning, first thing before any food, she was to drink 500 milliliters of water, about 2 cups, with half a teaspoon of unrefined sea salt and the juice of half a lemon mixed in. Then, throughout the day, every time she drank water, she was to add a small pinch of salt, just enough that she could barely taste it. That was it. No expensive supplements, no IV therapy, no medical intervention beyond adjusting the mineral content of her water. She called me 2 weeks later. Her energy had returned. The headaches were gone. Her skin looked healthier. She was urinating normally, maybe 4 or 5 times a day instead of 15. The constant brain fog she had been living with for 2 years had lifted. She said she felt like herself again. That is not a miracle. That is basic physiology being respected. Now here is where it gets critical. Not all salt is the same. Table salt, the white refined stuff in the blue cylinder that says iodized, that has been stripped of every mineral except sodium and chloride. It has been bleached, it has been processed, and it has been mixed with anti-caking agents. When you add that to water, you get sodium and chloride, but you are still missing magnesium, potassium, calcium, and trace minerals. Your cells need all of them. Unrefined sea salt, the kind that looks gray or pink, contains more than 80 trace minerals in the same proportions that exist in human blood. When you dissolve that in water, you create a solution that closely mimics your body's natural fluid composition. Your intestines recognize it, your cells recognize it. The sodium-potassium pumps in your cell membranes activate. The gates open. The water moves in. That is absorption. Here is your complete hydration protocol, clinically organized, step by step. When you wake up in the morning, your body is already dehydrated. You have gone 7 to 8 hours without water. Your blood is slightly thicker. Your cells are depleted. Before you eat anything, before you drink coffee, before you check your phone, drink this. 500 milliliters of room temperature water, that is about 2 cups, with half a teaspoon of unrefined sea salt and the juice of half a lemon. Stir it until the salt dissolves completely. Drink it slowly over 5 to 10 minutes. The lemon serves 2 purposes. First, it provides potassium and vitamin C. Second, the citric acid helps your stomach begin producing digestive enzymes, preparing your system for the food that will come later. The salt provides sodium and trace minerals. Together, they create the osmotic pull that drives water into your cells. You should feel the difference within 20 minutes. Your brain wakes up, your energy lifts, your digestion activates. Throughout the rest of the day, every time you drink water, add a small pinch of sea salt. You should barely taste it. If the water tastes strongly salty, you have added too much. The goal is approximately 1/8 of a teaspoon per 500 milliliters. You are not trying to make seawater. You are trying to create a mineral balance that supports absorption. If you exercise, if you sweat, if you live in a hot climate, increase the salt slightly. Sweat removes sodium from your body at a rate of approximately 1 gram per liter of sweat. If you run for an hour and sweat heavily, you can lose 2 to 3 grams of sodium. Replacing that is not optional. Without it, your performance drops, your recovery slows, and you increase your risk of heat exhaustion. Now, the practical section. What if you do not like the taste of salt water? Add natural flavor, a squeeze of lime, a few slices of cucumber, a handful of fresh mint leaves, a small piece of fresh ginger. These additions provide flavor and additional minerals without adding sugar or artificial ingredients. What you must not do is add commercial electrolyte powders or sports drinks. Read the label. The second ingredient, right after water, is sugar. A standard sports drink contains 25 to 35 grams of sugar per bottle. That sugar will cause an insulin spike, an energy crash 90 minutes later, and it will interfere with your body's natural thirst regulation. Here is the timeline for results. Within the first day, you should notice reduced urination frequency. Instead of every 30 to 45 minutes, you will urinate every 2 to 3 hours. That is normal. That is healthy. That means your kidneys are no longer dumping water to correct electrolyte imbalance. Within 3 to 5 days, you should notice improved energy, especially in the afternoon. The midday crash that you thought was normal, that will diminish or disappear entirely. Within 1 to 2 weeks, you should see visible changes in your skin. It will look more hydrated, more elastic, healthier. Fine lines around your eyes and mouth will soften. Your joints will feel more lubricated. If you have been experiencing muscle cramps, especially at night, those should stop. Within 2 to 3 weeks, if you have been dealing with chronic constipation, that should resolve. Your intestinal walls need water to produce the mucus that moves waste through your colon. When your cells are properly hydrated, your digestive system works as it should. Within 1 month, if you track your blood pressure, you may see it normalize. Chronic dehydration causes blood vessel constriction. Proper hydration allows those vessels to relax. Let me address the most common objection I hear. Doctor, I have high blood pressure. My doctor told me to reduce my salt intake. Now you are telling me to add salt to my water. Which is it? Here is the answer. The studies linking sodium to high blood pressure are based on diets containing processed food with refined table salt. A diet high in packaged foods, fast food, canned soups, frozen meals. That diet delivers 4,000 to 6,000 milligrams of sodium per day, almost all of it from refined salt combined with sugar, unhealthy fats, and chemical additives. That combination raises blood pressure. What I am recommending is different. I am recommending adding 1/2 to 3/4 of a teaspoon of unrefined sea salt to your water throughout the day. That provides approximately 1,200 to 1,800 milligrams of sodium, well within the healthy range, and it comes with balancing minerals that refined salt does not contain. If you are currently taking blood pressure medication, do not stop it based on this video. Discuss this hydration protocol with your prescribing physician. Monitor your blood pressure at home. Most people find that proper hydration, combined with reduced processed food intake, allows them to lower their medication dosage over time under medical supervision. Now, one more mechanism you need to understand. Your adrenal glands, 2 small organs sitting on top of your kidneys, produce a hormone called aldosterone. Aldosterone tells your kidneys how much sodium to retain and how much to excrete. When you are chronically dehydrated, your adrenal glands overproduce aldosterone, trying desperately to hold on to every bit of sodium because your body knows it needs minerals to absorb water. This chronic overproduction stresses your adrenal glands. Over time, they become fatigued. You develop what is called adrenal insufficiency. The symptoms are crushing fatigue, salt cravings, dizziness when standing up, low blood pressure, and inability to handle stress. Here is what nobody tells you. The solution is not adrenal supplements or adaptogenic herbs. The solution is giving your body the sodium it is begging for so your adrenal glands can stop working overtime. When you properly mineralize your water, your aldosterone levels normalize within 2 to 4 weeks. Your adrenal glands recover. Your energy returns. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. If you have been struggling with chronic fatigue, brain fog, headaches, muscle cramps, or constipation, and your doctor has told you everything is fine, try this protocol for 2 weeks. It costs less than $2. It requires no special equipment. It takes no additional time. You are already drinking water. You are simply adding minerals so your body can actually use it. One final point. If you see dark yellow urine, that does not necessarily mean you are dehydrated. Urine color is affected by many factors including B vitamins, certain foods, and medications. The better indicators of hydration status are thirst level, skin elasticity, energy level, and how often you urinate. If you are drinking mineralized water according to this protocol and you feel good, your skin looks healthy, your energy is stable, and you are urinating 4 to 6 times per day, you are hydrated. Do not obsess over urine color. The system makes money when you stay confused, when you buy expensive bottled water marketed as premium hydration, when you purchase electrolyte supplements in capsule form, when you go to IV hydration clinics. There is no profit in telling you that a 500-gram bag of unrefined sea salt costs $3 and will last you 6 months. There is no revenue in explaining that your body already knows how to hydrate itself perfectly if you simply give it the tools it needs. Subscribe to Dr. Waterling right now. Hit that like button. Share this video with someone you care about, a parent, a friend, someone who is always tired, someone who drinks water all day and still feels dehydrated. You may have just given them the answer they have been searching for. You are not broken. Your body is not failing. You have simply been following advice that ignores basic cellular physiology. Now you know better. Now you can fix it. Starting today.